My name is Nicolette Graves, and I lead the product marketing at JustWorks for all things health benefits. In a nutshell, I spend my days thinking about how can we provide our customers access to health benefits, but also that not only give you peace of mind, but also make you feel at home while you're using it. My background is in public health, so I'm super passionate about access to healthcare services you need, and especially go crazy about women's healthcare experiences. So needless to say, I'm super excited about today's webinar. Here at JustWorks, one of the things we really try to keep top of mind is how can we make sure we're supporting our customers throughout each life stage. One of those stages is family planning and reproductive care. After talking to a ton of customers, we've realized navigating healthcare is confusing, overwhelming, and just not that fun. What I would like to say is like the complete opposite of the sentiment you're trying to have while planning for something as exciting as family. Because of that, we thought it'd be great to bring together two physicians from two of our providers, One Medical and Kindbody. But that's my brief spiel. I'm going to let the both of them introduce who they are, what they do, and a little bit about both of their services that they provide. Navia?
Yeah, hi everyone. It's nice to be here. I am a family physician at One Medical, and I'm also the program medical director for sexual and reproductive health. I grew up in Montreal and I did my training at McGill University, and I did my residency in family medicine, so covered pediatrics, and then also did a fellowship in women's health. So definitely very passionate about women's health and everything that has to do with it. Really excited to be here and talk to you guys about building your care unit, especially during these crazy and uncertain times. And I'm happy to be here to support you guys. And if you have any questions, please don't hesitate to put them in the Q&A.
Awesome. I'm Dr. Fahima Sassan. I'm a board-certified OBGYN and the founding physician of Kindbody. I did my training at Mount Sinai here in New York and was there for 12 years prior to founding Kindbody. And one of our focuses is to really reinvent the delivery of women's health, recognizing that this area is often very fragmented and people come into this journey of their life, or this aspect of the journey of life, with a lot of anxiety, and we really want to take that away by improving access, by providing information, by empowering you with options. And really excited to be here today, and really partnering with One Medical and JustWorks to really provide the best care as seamlessly as possible.
Awesome. So let me tell you a little bit about One Medical. I'm really proud to be working there, and it's a national membership-based primary care practice, and we offer really seamless digital health in the office and online, virtually across the country. We're founded in 2007 and have sort of really expanded from then, and we decided to design our services with our members at the center of it, really keeping the members' needs at top of mind. And today we have about 80 offices across the country and have sort of expanded our services to provide a full spectrum of care for our members. So not only women's health, but also pediatrics. And this is, just really great news. JustWorks members get a free annual One Medical membership through their employer. So that's really wonderful to know.
Awesome. And at Kindbody, we really wanted to bring together a place where women and men can really take care of everything that would have to do with their reproductive journey, with a key focus of bringing that care to you as early as possible. With our current kind of healthcare system, people often wait too long to get care or to start fertility treatments, and we know that that's often the number one thing that can harm a couple's potential of becoming pregnant and achieving a healthy pregnancy. And so by bringing under the same roof everything from the actual medicine and fertility treatments to the preconception evaluations and mental health and nutrition support and all of these things that go hand in hand, we feel that we can best affect that patient, the individual patient. We are located in New York, San Francisco, Los Angeles. We have centers of excellence across the country, and one of our core values is to really make sure that every step of the way you feel like you have a partner in this journey. And we're excited to be also providing a Kindbody membership. That's an annual membership through our beta program with JustWorks, and that provides you not only the membership to have access to our fertility doctors and GYN doctors, but also discounts towards fertility treatments.
So I often get the question, like, what's so great about One Medical? And there's a few things. So like really building that solid relationship with your primary care provider is so important for a number of reasons. To really sort of establish that care that you need moving forward, to build the foundations for whatever journey you're going into, whether that be a fertility journey, whether that be a career journey, whatever that may look like. And so at One Medical, you really do get more time with your primary care provider, so you don't feel rushed. You can cover sort of preventative care, mental health, women's health, men's health, trans care. We have all of it under our roof. You can message your healthcare provider through the app directly, which is amazing. For many of my patients tell me, like, this is awesome. I can access you when I need to answer the questions that are specific to my care. We also have amazing 24/7 virtual care with our virtual medical team. You can renew your medications through the app, so you don't have to necessarily call in and be on the line. It's really sort of a seamless process. And we have mental health support groups and health coaching programs as well.
All right. So at Kindbody, one of our true fundamental core services is the fertility aspect. And so we recognize that not everyone, as they're trying to conceive, is going to have the same issues. And so really our focus is to make sure that every man and woman, as they embark on the journey of either thinking about pregnancy or maybe you've already had some issues trying to conceive, that we really address the reproductive health and fertility care that you need from square one. And so we do have full service care, so not just though for IVF and intrauterine insemination, which are things that people might be familiar with, but sometimes it's just understanding that your fertility is understood. And so from understanding preconception care to gynecologic care and how they impact your fertility, being able to meet with mental health specialists and nutritionists to make sure that you're optimized for pregnancy in every facet. And then understanding that not all couples are the same. So you may be a woman who's trying to conceive on your own, and how do we navigate donor sperm? You may be a couple that is conceiving and is a same-sex male couple, and how do we navigate getting donor egg and surrogacy? So really understanding the entire spectrum of the fertility experience and recognizing the sooner we see you as providers, the sooner and more options we can provide you. We also do have 24-hour access to our physicians. So again, through our portal, patients can access their providers directly, same way that Navia was presenting at One Medical. And we understand that really is the modern day way that healthcare should be provided. And then recognizing that fertility care can often be expensive, and we want to improve that access by lowering the prices. And again, through the partnership with JustWorks and using your Aetna insurance along with the added benefits through Kindbody, we really are making this more accessible from a financial perspective as well.
So building your care unit, it really sort of starts with your primary care provider. Over time, you get to know each other. You get to have a strong relationship in terms of depending on your provider for moments in your life that can be challenging. And this really lends to having great support and also helping you in your journey for preventative care. Whether that is a diagnosis of depression, dealing with stress during a pandemic, or navigating your fertility, you really have someone who you can rely on to put your health priorities first and really listen to what your needs are.
And on that same topic, when it specifically comes to fertility, a lot of patients will come to me and say, you know, I went to a doctor and they told my partner and I, this is what you must do, and okay, see you tomorrow to schedule this. In fertility, oftentimes people feel like they're being rushed along the process. And so one of our core focuses is to really make you a partner in the journey, so that we're not just going to say, here's your only option. For example, IVF is your only option, but recognizing sometimes people do need baby steps. And so going over options like timed intercourse or intrauterine insemination and really walking you through, here's how successful this non-invasive treatment can be versus here's how successful an invasive treatment will be, and allow you to really be a partner in making the decision that works for you, recognizing that some people really do need those baby steps to achieve a goal, and some people are like, no, how do I get pregnant? I just want to do what's going to give me the maximum chance for success. And sometimes, you know, there's wiggle room to really make a decision together, and so that patient-centered decision making is something that's really paramount to us.
So today we're going to be walking you through how One Medical and Kindbody provide care throughout your family planning, pregnancy, and postnatal journey. We'll share with you what you should know and what to expect at each point of your journey, and really, you know, we're here to support you. It can be really hard to know where to find information, who you can get your answers from, and what you should be considering, but we're definitely here to help.
Absolutely, and we're going to focus on this portion a little bit more in the next few slides, but one of our, you know, my biggest take-home messages for the audience would be that you're never too young or too old to explore your options, and it's never too early to get a full evaluation to truly understand what's going on with your body. You might be the healthiest human being and doing everything correctly, and you may still have a fertility issue. So really recognizing the importance of having your general health through through a family practitioner and through One Medical intertwined with your specialty care is so important from the very first step, and isn't something that should be an afterthought. And that's how we can work together to be as proactive as possible. It's really paramount, and especially when it comes to fertility.
Cool. So this is just a super quick reminder, everyone, that we will be doing a Q&A at the end of today's presentation. So feel free to send them over in the Q&A box.
So I get this question a lot from my patients of like, when do I feel ready, or when am I, what should I consider in asking myself when I should be ready? And I think that there are multiple factors to that, and I think it's different for every person. You know, I often will prompt or try to give key questions to patients that they can ask themselves, but I also understand that these questions can be really overwhelming. And so I don't want necessarily to bombard a patient with being like, here are all the questions that you need to consider and you need to figure out all this stuff ASAP. No, it's a step-by-step process, right? It's a question that you can consider, you sit with, you talk about it with your support team or your partner, and figure it out from there. And some of the questions that I usually ask is like, you know, do you want to get pregnant? And what is your timeline? What does that look like? Is there a partner in the picture? And are you both sort of on the same page? And if there isn't a partner in the picture, do you have a support team that can help you through the process of conceiving, pregnancy, and afterwards? What are your career goals, and how does that fit into your other goals that you may have in your life? And are you in good health, like mentally and physically? And that's definitely something where primary care, or your relationship with your primary care provider, can help sort of establish those good foundations before sort of moving forward in this journey.
And I'll just add to that, that if the answer to all of these questions is I have no idea, or for sure I'm not quite ready yet, to recognize something like egg freezing can really help you draw out or prolong your timeline. So maybe the answer is yes, I want to have kids, but I don't want to have them for another 5 years, or I'm not quite in a healthy relationship right now, and allowing us to help you navigate how to improve your relationship or your finances or whatever the case may be, that there are options to actually allow, especially as women, because we know that our reproductive journey is so dependent on our age, that you can actually prolong that timeline so that you are in the right place to have a family and start a pregnancy, and maybe try to take away some of the pressures that we have on ourselves by having that peace of mind or that backup plan of having frozen eggs or embryos, depending on where you are in your relationship status. status. And so I think this is a really nice opportunity not only to take care of your general health, but to say, I do want kids, I'm just not quite ready for them, and to know that like egg freezing can be a great option to give you more time.
So when, patients come for an appointment and they're ready to start trying and they don't really know where to start, usually it looks a little bit like a visit that you would have with your primary care for an annual visit. It's really looking through your history, asking about your family history, going through the medications that you might be taking, considering if they're safe in pregnancy. An example would be I have multiple patients who are on ADHD medication and are considering getting pregnant, and that can be really challenging for them because they don't want to give up on some of their career goals, and they truly need that medication to help them through their process. And that is something to consider. It's not necessarily, oh no, that medication is considered, not safe in pregnancy. Let's have you stop that. Let's have you wean off. It's really about weighing the risk versus benefit and talking with your provider. And that I might not necessarily have all the answers for that, but that's something where we can help navigate and give you the support that you need. We work with Mount Sinai, and there are reproductive psychiatrists who I refer my patients to, who are able to answer those questions and find a middle ground where you can have a good quality of life throughout your pregnancy and still have a really safe pregnancy.
Totally agree with Navia, and we'll add to that the important things that you can do in addition are really being prepared for that pregnancy and doing things like genetic carrier screening. So genetic carrier screening is where we can actually screen a couple for 283 diseases to see if you are a genetic carrier. And where that becomes particularly important is recognizing and seeing if you and your partner are potentially carriers for the same disease. And these are all things that you can do before pregnancy so that you know your options. In the event that you and your partner are both carriers for the same disease, then we can talk to you and explore with you what is that disease, how severe is the disease, and what are ways that you can do to actually prevent the transmission of that disease to a baby. And so these are all things that become so important, and we encourage you to talk to us as family care doctors as well as OBGYNs so that we can say, okay, here's all of the aspects of things that you should consider, as opposed to sometimes when people just show up and say, okay, I'm pregnant, now what do I do? The earlier you kind of seek this type of care, the better and more productive, and the more we can utilize technology and science at our fingertips. The aspects of, and specifically on this slide where we talk about you've been trying for a while and you have no results, everyone often, we kind of spend our entire lives thinking that the moment we have unprotected sex, we're going to end up pregnant. We kind of spend our whole lives trying not to get pregnant. So when we're actually ready to have a baby, it can be quite scary. Like, well, why aren't I pregnant yet? I had sex once or twice. And so especially as the months go on, I recognize how scary this can be. And so my key thing is not to wait, and I'm not saying that if you don't get pregnant your first month of trying, there's something wrong. And we know that 85% of couples who are fertile will conceive within a year of trying. But to not prolong it, to say, okay, I just want to make sure everything is good. I want to make sure my bases are covered. I want to make sure my partner's sperm count is good, concentration, things like that. And then I also want to make sure that I'm good. Am I fertile? Can I actually have babies? And then once we see if there is a problem, then we can address it. And my take-home message to all of this is people think that the solution to all fertility issues is in vitro fertilization, which for most people sounds quite invasive. And the take-home is that that's not always the case. Sometimes it's just making sure that you and your partner are having sex during the right time, during your fertile window, which is timed intercourse, and then walking you through the other options. And then if it comes down to that adoption or surrogacy is something that you need to consider, then we can help you navigate that as well. All right, so you're pregnant. Now what? So certainly, I think this is where it becomes so important to have a good partner on your side. So Kindbody, we would refer you to an OBGYN, and we talk really about the importance of finding the correct partner. You want to have an OBGYN that you feel comfortable with. Obviously, you're going through one of the most incredible experiences of your life with this person. You want to just make sure you're on the same wavelength. And so talking about labor plans, maybe even before you're pregnant or early in pregnancy, what are your thoughts? You definitely are scared completely of the actual birth process, and talking through that and recognizing that maybe it's not as scary as you once thought. Assembling a support system, including therapists, and recognizing that it's not always a bad thing to need a neutral third party to talk to through your fears and anxieties. Packing a hospital bag, it should be more fun than it is scary, and we can help you navigate all of that as well. I think one of the cool parts is that Navi and I are both moms ourselves, and so we can kind of help you with some of that personal experience that's important. And then making sure that you're taking care of yourself. I think particularly as women, when they embark on a pregnancy, you become so focused on the baby that you forget to kind of take care of yourself. And often you're working and you're pregnant and you're trying to prepare for a baby. And so you're juggling a lot of things, and just recognizing the importance of support, mental health, taking care of your nutrition, not being overly scared that you can't, ever have a cup of coffee when you're pregnant, and that you can't touch XYZ because you're pregnant, and recognizing that it's not actually as scary or strict as one might think. Then obviously right now we're at very challenging times with this COVID crisis and pandemic, just recognizing that from a medical perspective as an OBGYN through the American College of Obstetrics and Gynecology, the CDC, and kind of supported by all of the medical associations, is that there has not been shown any specific facts that COVID-19 puts pregnant women at higher risk. We know that pregnant women have slightly lowered immune systems as a result of being pregnant. But for that, I would say that that's just important things that we should all be taking care of: washing our hands, doing social distancing, wearing masks, staying away from people who we know are affected. And so those are all things that we should be doing anyway. And so you want to take those extra precautions during pregnancy. But there's no evidence to show that COVID-19 causes any birth defects or causes any specific harms to pregnancy itself, and that's a really important message to convey. And whether that pregnancy is conceived naturally or that pregnancy is conceived through fertility treatments, whether that's IVF or IUI, that is well supported by all of the medical societies, that COVID-19 has not been shown to be a direct risk. And that you don't need to be tested more often or more frequently as a result of it. Obviously, hospitals will have different recommendations, particularly, for example, if you have a scheduled C-section, which Navi will speak to in a moment. But as far as I could just generally speaking, you should continue to live your life, hopefully the way we're all living our lives, which is by social distancing, wearing masks, washing our hands, and that you don't have to do anything differently because you're pregnant or planning to be pregnant.
Yeah, that's awesome. I wanted to emphasize a little bit what Fahima had mentioned about finding a right fit. I had my son 10 months ago, and when I started with my pregnancy, I was with an OBGYN that wasn't a good fit. And I felt actually really vulnerable at that time. And it was really important for me that I be with someone that I felt comfortable with. And it was harder to make that switch than I thought. And I reached out to my therapist and actually had a session with her about, like, how do I navigate this? And finally feeling like, okay, I need to feel empowered to be able to find the right fit and be with someone who I'm comfortable with. So I really urge my patients to, like, you don't feel comfortable with the OBGYN that you're with, or whoever is taking care of you during your pregnancy, definitely don't be afraid to say something or do something about it. You want to feel as comfortable as you can and have all of your answers, all of your questions answered. And then in terms of support group, we've been talking a lot about, like, healthcare providers, but there's also, like, other things that you can look into. I had a doula for my pregnancy. She was an amazing support during my pregnancy. And then at the delivery itself, my husband and I went to a childbirth class in our third trimester, and that was really helpful for us to just sort of experience it together and learn together what this process might look like. And then in terms of, now in the hospitals, One Medical is affiliated with Mount Sinai, and at Mount Sinai, what they're currently doing, and I feel like this is probably similar in most hospitals in the city right now, is they are screening you for symptoms of COVID when you do come in labor. They're screening your partner and they're screening your other support person. So you are allowed 2 other people in the room currently. Clearly, if any of them have symptoms, then they won't be allowed in the room. And if you have a scheduled C-section, then what they do is they test you 48 hours before that date. And then, obviously based on the results, they'll move forward from there.
And I just think that, sorry, just really quick, Nicolette, before you proceed, but I think one of the things we were just both talking about at the end of the day is really core to what both One Medical and Kindbody are providing, is that through all of this, whether you're pregnant, thinking about being pregnant, or don't want to be pregnant for another 10 years, how important it is to just be partners in this journey. And I think that's what our 2 organizations, who in this big scheme of things are both relatively new, are really core at our principle, is having doctors that you can actually have a conversation with, whether it's about your sinus infection or about your pap smear or your contraception or pregnancies or whatever it may be, but just recognizing the true importance of that. And just by things that we're doing like today and having this webinar, it just, I think, really goes to the core of how important it is to have healthcare providers in every aspect that are truly kind of in your corner. Navia, did you want me to take this one? Sorry. You got it.
I can definitely speak to this.
Yeah, go ahead.
I definitely, transitioning into motherhood was certainly a wake-up call. It is an absolute change of your life. The first 8 weeks for me was, a blur. There's a lot of emotions happening. There's a lot of ups and downs, really joyful, but also stressful moments. And I think it's really important, at least it was for me, and I try to stress this as well, is that we hold on to some of our identity through this process, because it is a big transition when you are becoming a mother. And as Fahima has said before, like often you're giving, and you're not necessarily looking at yourself or taking the self-care that you need. And I think that's really, really important. Postpartum care is so important. And I think we talk a little bit about that later, but just in general, transitioning as a mom, it's an adventure. And I think it's different for everyone and it looks different for everyone. And having your community is really, really important. For me personally, I was in a postpartum moms group that's helped me tremendously. Just to be around other moms who had babies around the same age was so helpful. So, talking about postpartum, your mind and your body have really just gone through so much. And, we often spend so much time taking care of our baby, taking care of our family, making sure everything is the way you feel like it should be, that you tend to forget about yourself. And that can absolutely happen. And it's important to rest and have your body rejuvenate. Often I had so many people telling me nap when the baby naps, and I'm a terrible napper. I can't nap. And so for me, it was difficult to do that. But I realized the importance of it as your body just is tired and needs that time to recoup mentally and physically. It's interesting because the Association of Obstetricians and Gynecologists used to have the recommendation of the first postpartum visit at 6 weeks. They recently moved that up to 3 weeks because I think realizing the importance of having that check-in earlier. There's so many changes that can happen, and postpartum depression, postpartum anxiety is really common, and it can sneak up on you. And you won't even notice it. And you may feel like you're drowning and not even know that there's a way to actually get help and to treat it. And so I think, reaching out and getting that care when you need it, even if it's before 3 weeks, is so important, whether that be with a lactation consultant to help with feeding, whether that be with a sleep consultant to help with sleep, or speaking to your pediatrician, Or also talking to your primary care about mental health and just in general how you're feeling and how you're transitioning, as well as, of course, your obstetrician.
Absolutely, and I can't second that. And I think one of the greatest platforms that we bring for you, both at Kindbody and at One Medical, is access to all of this under one roof, so that you can schedule a virtual appointment with a therapist or a nutritionist as you try to navigate kind of your postpartum body and breastfeeding, and what do I need, what support do I need, so that you don't have to find a separate mental health doctor to make a separate appointment, that you can do all of that through Kindbody, and then also recognizing that as some of the perks that we have through this beta program with JustWorks is with lactation consultants and really helping you navigate getting back to work if that's a priority for you. And so these are all things that we can provide under the same platform, so that we don't just say, oh, you're pregnant now, bye-bye, you know, take care, which is what often happens in fertility clinics, but really helping, help holding your hand afterwards too, which, as Navia said, is often neglected and so vitally important.
So we have pediatrics at One Medical, and that's been a fairly new addition, but we have it in New York, in SF, Phoenix, Los Angeles, and Portland. And we really sort of cover everything in the realm of pediatrics. And what's really nice at One Medical is you can actually come for your own appointment and then have at the same day see your pediatrician with your infant or child, and really help guide you with your pediatrician and your primary care through those first really challenging months when you're establishing feeding or sleeping, and just your concerns, coming in with your list of questions and concerns. So many people were like, oh, Navia, you know a lot of this, like you should be totally fine. I had so many questions, and my pediatrician, who's actually at One Medical, was amazing. She took so much time to answer all of our questions, to answer my husband's questions. And that's really, really important, especially at the beginning when there's so much that's unknown and so much that's different.
All right, so at Kindbody, we'll work with One Medical and, like I said, the pediatricians and your family practice doctors to really help you navigate through that postpartum journey. And we touched upon this a little bit before, but really having lactation consultants and follow-up. Breastfeeding is not easy. People, even women, but anyone who hasn't breastfed before thinks that it's kind of like a magnet. The two ends should just come together and it looks easy on TV, but it's actually really a difficult process that can take time to really, it can be painful initially. Some women's milk doesn't come in as quickly as others, so you need to supplement all of that, so really helping you to go through that. And then really figuring it out, like what's the right balance for me as I go back to work. And it may sound a little bit touchy-feely, but it's reality. Like it's really hard to work full-time and have a newborn, and nowadays, especially as restrictions of how much time people have off are sometimes, I think, obscene. But like I, as an OBGYN, which you would think you'd have like the best maternity leave, I had 6 weeks off after my baby was born and went back to work. And so kind of just understanding how important that return to work coaching is that we provide, I think is really important. And then never neglecting that mental health and nutrition, which are so, so vitally important, because if you're not well, you're not going to take care of your baby well. And those two things really go hand in hand. And then we can actually even help coordinate breast milk shipments, and recognizing that you can actually get, for some reason you don't have breast milk yourself, whether because you're a same-sex male couple or you for yourself for some reason don't produce, that there are amazingly other avenues where you can get breast milk, and just helping you navigate all of that. So I think the take home is that pregnancy does not end with the birth of a child. Actually, I think that's where the actual physical birth occurs, but the real time for need for a support group and where it takes a village is the moment the baby's born and afterwards. And so we are both here to help you navigate all of the little nuances that are often not spoken of and forgotten.
Absolutely. That term of like it takes a village is so valid. And any support you can get in any form is so vital at that time. So, it's been a crazy few months, and once all this sort of started with COVID in March, we really came together as a company and quickly started to think of ways of how we can support our members. And our 24/7 virtual medical team really continues to provide care for all your concerns, including answering questions and supporting patients who may have COVID-like symptoms or whose regular like plans, like health plans that they had in mind got rerouted because of COVID. And what does that actually look like? And that, and access to your primary care. We have now remote visits where you can have an appointment with your primary care in the comfort of your own home and either review your own health in terms of like what is happening, how are you taking care of yourself during this time, and also reviewing any kind of symptoms that you might have that may look like COVID. And like, what does that mean? How do I navigate that? Do I go in for testing? The rules, I feel like, are the guidelines are changing on a daily basis. And sort of keeping up with that has been definitely challenging. And I think is important for us to constantly check in with our primary care to see if we are doing all the things that we can be doing to avoid getting sick. And in terms of fertility, I think that this is also a great way of how we work together. We really can refer to each other at this time, and having such robust virtual platforms is so helpful for that.
Absolutely. I think one of the most important things to understand, when COVID first started, I think everybody thought this was going to be a problem that would be resolved in a few weeks, maybe a month. And okay, well, I can not see the doctor for 2 to 4 weeks, no problem. I'll reschedule that appointment and everything will be fine. Unfortunately, that has not been the case, and it's already July. So, and what I hope and what we really want to direct to women is that we know that fertility declines with age. We know that time is the worst enemy to a woman who is having fertility issues or who wants to conceive. And so this is no longer a few weeks or a month. It's now no end in sight, right? And until really a vaccine comes along, the things that we're seeing in the news and social distancing and staying away from hospitals and things like that is really going to be our new normal, unfortunately. And so as a result, we really do want to stress that fertility care is essential, that women's health is essential. And for anybody watching here who was supposed to have their annual checkup or their physical or was supposed to see the doctor for that follow-up abnormal pap smear maybe in March, but you just kept putting it off, recognize it's already July. And reach out to us. If you're not quite ready to come to a doctor's office, even though we are taking extreme precautions, we check all of our patients' temperatures, everyone's wearing masks and gloves upon entry. We separate our appointments so that you're not actually waiting in a waiting room. You're going directly into a room. We're limiting the staff that you interact with so that the same nurse who brings you in is the same nurse who draws your blood. It's all done in the same room so that you can literally come, have an ultrasound, have a physical exam, see the doctor, have your blood drawn without having to go through various areas even of our own office, but also do virtual appointments. If there's a problem that you've been having, you're not quite ready to go to the doctor's office, let's do a virtual appointment from the comfort of your own home, 7 days a week, figure out what's going on, and then we can help you navigate, okay, yes, you definitely need to come in, you definitely need to see your PCP, you definitely need to see us, or whatever the case may be, and then maybe better understand your options. And then really understanding that if you are a couple who's interested in pregnancy, unfortunately for many couples, especially the ones that are having issues, time is often not on our side, and to really be cognizant of that, and don't let being fearful of COVID further delay any necessary medical care that you need.
In terms of insurance, we definitely at One Medical, anything that's part of our app or our 24/7 virtual medical care that we have, provider messaging, prescription renewals, that really is part of the membership. And so that's no cost to you in terms of processing through your insurance. When it comes to your in-office appointments or your remote visits, for each visit, your insurance plan will be billed as it normally is, and it would just sort of be covered in the way that it typically is with your deductible, considering your deductible and or your copay.
And at Kindbody as well, we are fully in network with Aetna, so any care that you receive through us, whether it's for specialty gynecologic care or fertility care, would all be processed through your Aetna plan. And again, deductibles would apply where they do. And I think we really pride ourselves in is being fully transparent, so that if you do need, for example, genetic carrier screening, or you need some special blood work or evaluation for a fertility issue, that we let you know beforehand exactly what's covered by insurance, what your deductible is, and what maybe not be covered by your insurance. And then really special is, as of November 1, Just Work members in New York State are also eligible for 3 rounds of in vitro fertilization under the New York State mandate. For anyone who's ever known anyone who's gone through IVF unfortunately is very expensive, and so being eligible for these 3 rounds of coverage, even with the costs at Kindbody, which are up to 40% lower than other fertility clinics in New York, it still ends up being a substantial saving. And all of this, especially when it comes to fertility care and insurance and what's covered, can be confusing, and that's one of our goals, is to take that confusion off of your plate. So we have designated benefits specialists that will contact you and specifically say, okay, Jane Doe, this is what you have, this is how much you owe, this is your deductible, this goes towards the deductible, this doesn't. So we don't want you to feel alone as you navigate what even I feel like I know some things about this, find confusing. We want to help you navigate it and really want to be your partner in this one part, because we have enough to worry about when we're trying to get pregnant, or when we are pregnant, or when we're trying to navigate our health, especially now during COVID. And we don't want you to feel alone when you're navigating your insurance or your benefits. So we definitely have a full designated team to help you answer these questions specifically.
Cool. So getting started, you guys are probably now wondering, how do I actually use these 2 benefits? So they both work fairly similarly. So for both of them, you get a free annual membership. Well, for Kindbody, it's a beta for now, but it's still a year-long membership. And the way it works is you go to the websites listed here, which is onemedical.com/justworks, and then kindbody.com /justworks. And then from there, once you've activated your membership, you can log in online. You can go through either of their apps. And then for Kindbody, you can actually email navigator@kindbody.com to get started. And so we're going to jump over to the Q&A section. I'm going to pull up some of the questions you guys sent through while we were chatting. Interesting. Okay, cool. So the first question is going to go to Navia. So Navia, the question is it advised to wait to have a child until there's a vaccine for COVID-19? I'm 31 years old and would like to have a child in the next few years.
That's a great question. I don't think, and as Fahima mentioned during the presentation, really time you want to have time on your side. And so if those are your plans, I would absolutely move forward with them and not necessarily consider COVID to be a factor in it. I think it's important, and I think it's important to be aware of and take the precautions that we need to take. But I don't think it should stop you from trying to get pregnant.
I'll second that. And I think one of the things that I would actually encourage you to do as a 31-year-old is to start off by having a fertility assessment, because there are some 31-year-olds who are very fertile and you may have more options, such as waiting. And there's some 31-year-olds, actually 20% of women under the age of 35 will have diminished fertility and not know it. And so start off first by actually knowing your facts, objectively are you fertile and what is your timeline looking like? But we really have no evidence to show that someone should not get pregnant specifically because of COVID. And so while I understand this is a scary time, we just don't have the medical evidence to tell someone not to get pregnant at this time.
Great answer. And kind of piggybacking off of that, Fahima, the next question is, when should we be concerned about being infertile? I will be 35 in September, and I've been actively trying to conceive for 4 months after stopping birth control at the end of February.
Yeah, that's a really good question, and that's what I meant during the talk, where we kind of spend our whole lives trying not to get pregnant, and now we are, and you're like deer in headlights. Oh my gosh. So as a 35-year-old, you've been trying for 4 months, and I don't want to scare you. You may end up finding out you're pregnant tomorrow. You just never know. But as a 35-year-old, my key thing would be to come in and let's do a fertility assessment and see. Let's check your partner. Let's check you. And it's not by any really invasive measures. It's just checking your egg count, seeing what your ovarian reserve looks like, checking a sperm semen analysis for your partner, making sure that his sperm count, concentration, shape are normal, and then also just checking our boxes and making sure you've had preconception testing done that Navia mentioned, that your thyroid function is good. There's so many aspects of health that are important for getting pregnant and then subsequently staying pregnant. And I just think the key is that it's never too early to at least just make sure that everything is fine. And then the best news you hear is everything is fine. And then you go into the next few months with peace of mind, or you find out that there is an issue and then we can take action sooner. And so, 4 months is acceptable. At the age of 35, we say that fertility, if you haven't gotten pregnant within 6 months of trying, that you should definitely seek fertility care, but there's nothing wrong in getting that care now and either finding out that there's an issue that you could start addressing, sooner the better, or that everything is fine and you can continue to try for a few more months with peace of mind.
Cool, interesting. So I have a question that actually is another piggyback off the original piggyback. So I'm 35 years old. Can you tell me more about my options for freezing my eggs? How much it would cost for the procedure and storage fees, and what to expect? How long is the actual procedure? And during COVID, what precautions are Kindbody taking?
Yeah, absolutely. So egg freezing is a process that can really be open to, or an option for women in their 20s, 30s, and for select women even in their early 40s. So again, you're never too old or too young to consider preserving your fertility in the form of egg freezing. The first process is finding out what is your fertility. So what's your baseline? What are we working with? And so that's something that we can do with a fertility assessment. You can be done at any time during your cycle, even while you're on birth control, IUD, etc. So we can find out, all right, how many eggs do you have? What is your fertility like? How many cycles of egg freezing do you need? And then some of the questions that Navia was asking you to ask yourself, like, how many kids do you want, right? Realistically, how old are you going to be when you have your first child? Realistically, how old are you going to be when you have your last child? These are all matters that become instrumentally important as we think about egg freezing. As someone who would like to have 2 or 3 children and they're already 35, and they're not ready to have their first baby yet, for sure needs to freeze their eggs in order to be able to have their second or third child in the future. So it becomes extremely important to initially do the assessment and then have an honest conversation about how many kids you want to have and when you anticipate you'll be having them. The actual egg freezing process takes about 2 weeks. It's injections to help your eggs mature, and then a retrieval process that's done under anesthesia, and that's done all through Kindbody. The pricing for an egg freezing cycle will be discounted, and Kara, who's on our team, can jump in, but through JustWorks and our partnership would be 10% off. So the normal price is $6,500 for a cycle of egg freezing. JustWorks members would have 10% off of that. That includes all the visits, all the ultrasounds, the retrieval, the anesthesia for the retrieval, and the first year of storage. In addition to that would be the cost of the medications. And the nice part about Kindbody is we're all about transparency. So after your first visit, we'll be able to tell you down to the penny how much will your medicine cost and what will your cycle cost, so that we know that obviously finances play a big role in all of our lives, so that you can actually know from the get-go down really to the penny, including the medications, what this will cost you. And I think that's something that's very unique. Most places, especially when it comes to fertility, kind of have a lot of hidden, like anesthesia is not included, and then you find out later that that's an additional fee. So that is all included in our pricing. And you can go to our website at kindbody.com, and it's all really clearly there for you.
Great answer. So we have a couple more questions that have come in. The next one I'm going to ask Navia. So Navia, going back to, you brought up doula, using a doula for your own delivery. So the question is, would you recommend a home birth or doula versus a hospital birth during COVID?
Great question. I think a lot of it comes down to knowing what your options are and talking with your partner and deciding what your preferences are. I definitely think that it's also worth talking to your obstetrician or your primary care to just sort of review what your medical history is. Depending on what your medical history is, you might not have the option to have a home birth, and it might be more safe for you to have it in the hospital. And then in terms of the doula is really someone who's not medically trained to help you with the delivery, but is there to be a labor support, as labor support. So that the doula could be in your home, could be in the hospital, could be in a birthing center. It could be in all of the above. Whether you go the route of midwife versus obstetrician, I really think that depends on the patient's preference and just sort of figuring out what the nuances and differences are and your personal preference. Fahima, I'm sure you have something to add in on that as well.
Yeah, I think the most important thing is not to make up your mind before you've actually talked to a doctor, because there's so many different aspects that we may not be thinking about. So sometimes people walk into it saying, I would really like to deliver my baby at home. But then you find out that, well, based on your age or the fact that you have, a certain anatomy or the positioning of your baby, or because you're high risk because of other medical issues, or you've become high risk during your pregnancy because of XYZ. Again, a lot of the nuances are beyond the scope of this discussion, but I think it's just recognizing that trust that's why it's so important to have a provider that you trust, so that you can have an open, honest discussion, so it doesn't become like, well, I want to do this and she doesn't want me to do that. But it's understanding that maybe your doctor is recommending certain things to you based on their expertise as it relates to you specifically. The doulas, I think, are a wonderful support system, and recognizing that can be done in a typical hospital setting, and that just because someone has, for example, an epidural doesn't mean that you cannot still have a natural birth where you're pushing and taking your time, and maybe even pushing on your hands and knees as opposed to pushing on your back. So I think a lot of people mistake delivering in a hospital as just because someone delivers in a hospital, it means that they have some sort of like very sterile, medical birth, and that you can actually have a very natural birth in a hospital setting as well. So I just think it's really important to recognize that this is something that really needs to be individualized, and walking with your doctor through every step of it, or your provider, and then understanding your options, and then being flexible that maybe something's going to occur in that 9 months of the pregnancy where your options might need to change. So it's just open, honest discussions, and it starts even before pregnancy, and so that's why I just think it's so good to have a provider and a team of providers that you trust and can communicate with openly.
Great answer. The next question is, can you, and I guess this will go to Fahima, can you please discuss family planning for women with PCOS?
Sure. So PCOS stands for polycystic ovarian syndrome. It's a very poorly named syndrome. It doesn't mean you have a bunch of cysts, not necessarily. So that I'll start off with. The other aspect of PCOS is that it's a very broad spectrum diagnosis. No two women with PCOS are going to be the same. And so really understanding what it is, what symptoms do you have, and how is it impacting you? Because there's some women with PCOS that get their period naturally maybe every 40 to 50 days, and then there's some women with PCOS that don't get a period for a year, 2 years, or they don't get a period at all unless a doctor gives them medication. And so depending on the severity of the symptoms or where you are in the spectrum, the care that you need is going to vary. And then also recognizing just because you may have been given a PCOS diagnosis when you were 17 years old doesn't necessarily mean that you still have that diagnosis now that you're in your 30s, that it is a fluid diagnosis that can change. It's a diagnosis that's really important to take in the whole body. Nutrition, diet, weight play a huge role in PCOS. Our other hormone levels like our thyroid, as well as our estrogen, progesterone, all these testosterone levels play a huge role. And it's something that, depending on where you are in your reproductive life, we treat differently. So if you are not interested in pregnancy, sometimes just birth control pills can help regulate your hormonal imbalance and treat some of the other symptoms like acne. If you are trying to conceive and you are getting periods once a month, then maybe you don't need much intervention at all. It just depends on the severity or scope of the presentation. The take home is that some women, I stress some women with PCOS can have difficulty conceiving, and it can be really simple things as just helping you ovulate. And by helping ovulation, we can then help achieve a pregnancy. And so that can sometimes just be with oral medications you take for 5 days and then telling you when to have sex. And then some women who have more severe disease may need to do egg freezing to prolong their fertility for the future, or may need in vitro fertilization. Take home is it varies dramatically from woman to woman. And if someone has ever mentioned that diagnosis to you, or you suspect you have a diagnosis, come and see us so we can really take all the layers of the onion and figure out exactly what pertains to you.
Perfect. Thank you, Fahima. Also, thank you, Navia. It seems like we are pretty close on time, and so we're going to close up shop now. So I want to first say thank you both for coming here to present on this super important topic, and thank you everyone else for attending. Please look out for a follow-up email with the webinar recording and the additional resources in the following days. So thanks again, everyone, for coming to the webinar.
Thanks for having me.
Thank you.